So by now, everybody's seen Kylie Jenner's comments about her implants on social media. What do her comments actually mean? 445cc, silicone, half under the muscle, moderate profile. I'm gonna break down all of these specific things for you so you can figure out how this might apply to you if you want breast implants and you like how Kylie Jenner looks and how you might ask for something similar to achieve similar results for your body. This is Dr. Shim Ching. I'm a board certified plastic surgeon in Honolulu, Hawaii. I've been doing plastic surgery for about almost 30. I not only practice in the US, I also practice in the Middle East, in Doha and Dubai. I've trained all over the world. I've done over 25,000 procedures. Breast augmentation is one of my specialties. So people who've listened to my videos know that breast augmentation is one of the most common procedures that plastic surgeons do in the United States and probably one of the most common procedures worldwide. It's a very common procedure, and probably this and liposuction are the two most common plastic surgery procedures that I perform in my office. If you've been following my YouTube channel, you know that I like to place the implants through an armpit incision. I feel that is almost a scarless way to do this surgery. The scar is hidden, it's not visible, doesn't have the disadvantage of having scar on the breast. Although surgeons can achieve great results with incisions placed on the breast, usually most commonly beside the areola and underneath the breast, what we call an inframammary incision. Almost all implants that we use nowadays are silicone, and that's what Kylie referenced when she said silicone. This is a silicone implant that she has, which is most common. And the reason why we use silicone implants is because they feel more natural, they don't leak, and they are the best implants available, in my opinion, for breast augmentation. The other choice that women have in the United States and elsewhere is a saline implant. The saline implant is filled with water, and those feel less natural. It's what we had to use before silicone implants came back onto the market. Some patients do choose saline, but that's why there's this distinction between a silicone-filled implant and a saline implant. So it's my advice to you as a plastic surgeon, if you're thinking about this procedure and you saw Kylie's comment, to get a silicone implant, because almost all plastic surgeons will agree that that's a better implant for most patients. Second feature of her comments that we need to talk about is sizing. So she has a 445cc implant. It sounds like she has that on both sides, and that's a good size for her. She looks beautiful, but it may not be the right size for you. And what I mean by that is that you can't really go by what somebody else has. Their body is different. Their breast size to begin with is different. And unless they are identical twin, and I talk about this constantly in my videos, you can't really go by what somebody else had and think that you're going to look the same. So I'm sure there's a ton of patients out there who go to a plastic surgeon nowadays and say, I want what she had, I want 445cc implants, but please understand that it may not look the same size on you as it does on Kylie Jenner. I think a more reasonable approach is to say that you want to look similar to her, show your surgeon, and your surgeon will be able to estimate what size you need to get there. And it could be 300, it could be 500, it really totally depends on your body and mostly your breast size to begin with. So don't get too hung up on the fact that you got 445 cc's and you have to get the same. Whatever size you choose is going to be right for your body and the size that you want, and that is really more important. And there's two ways to size implants that we like to do in my office, which you should consider if you go see a plastic surgeon. One is to put in implants in a bra, try that on, maybe a t-shirt over it, and that will give you a good idea of what that size is going to do for you after surgery. The other way that I like to also offer my patients is something called Vectra, which is a 3D camera setup which can simulate the placement of implants. And that's very nice because it is you, it looks like you, just have larger breasts. We can put in whatever size you want. And usually the two methods allow us to make our patients very confident going into surgery that they're going to get the size that they want and they like. So sizing is very important. Whatever size you get is going to have a number associated with it, but it won't be the same as somebody else. So there's not much point to ask for the same size as somebody else that you see either on social media or even somebody that you know for that matter. The other thing that Kylie talks about is a profile, and that is a moderate profile implant, which is a very interesting choice for her. I think it's given her a very beautiful, very natural, very complementary look to the rest of her body. And the way the profile works is that you can think of a profile as how wide the implant is relative to how much stuff is inside. So let's say we have a 300cc implant, just to throw out a normal number, an easy number to sort of work with. That 300 cc's you can think of as having a wider version, which is a wider or lower profile, and a more narrow version, which is a higher or more narrow profile. And that's really what the profile means. It's how wide the implant is relative to how much stuff is inside. And there's different profiles designed, in my opinion, for different women. Now, some surgeons will pick certain profiles so that they have a certain look. I don't really agree with that because I really feel that the profile is better suited to match the patient's body and their anatomy. I think you can't really make a certain profile look the same way on various, types of bodies and various types of women. So I don't choose a profile to make a woman look a certain way, but I try to match the implant and the profile of the implant to the patient's body. So a lower or wider profile will have a flatter look, less projection, less breast that's sticking out this way, and it'll be flatter and wider. Why would a patient want that, or why would a surgeon want to do that? Well, when an implant projects out too much, especially if it's too narrow, it's going to look a little bit fake. A flatter, wider implant, especially in the smaller sizes that I like to use it in, a moderate profile implant, works very well. It looks very natural. I think it works great in certain women, and I think it looks great on Kylie. So I feel that her surgeon, Garth Fisher, did an amazing job and she looks beautiful. The only caution I have about that is that when we get to wider implants, it can make a patient's chest look a bit wider, and some women don't want that. They don't really want their chest to look wider because it can make women look heavier. I think a very slim woman like Kylie, she really doesn't have a problem with it. But when you look at a wider implant in a wider chested individual, it can look a little bit too wide. And that's why a more narrow implant might be ideal for that kind of patient. So again, everybody's different. I would caution somebody on asking for something exactly like somebody else did. We're going to see a lot more of these celebrity reveals, I think, about their plastic surgery. For the longest time, the Kardashians wouldn't even admit that they had plastic surgery. I think this is an amazing thing that they're actually admitting that they had plastic surgery. They're actually giving credit to my colleague, Dr. Fisher, which is amazing. So now we've explained about the profile. Last thing I'm gonna talk about is half under the muscle. And that's gonna be something that's gonna be a little bit more difficult to explain and understand. And that's a very technical thing that plastic surgeons talk about, but patients don't usually talk about that. So when we place an implant in the chest, you can go either under or over the muscle. People who've listened to my channel, seen my other videos, and know that I like to place the implant both under and over the muscle, depending on the patient. But I see the vast majority of my colleagues and surgeons in the US place the implant underneath the muscle. Now, the interesting thing, and something that most patients don't know, is that when we place the implant underneath the muscle, it's not fully underneath the muscle. If it was, your implant would be all the way up here and it'll look ridiculous. So we have to cut the muscle partially so that the implant sits in the right spot, which is centered more or less where the breast is. And that can only be achieved if you partially cut the muscle. You only cut the part that isn't important for function. Because we're cutting the muscle, the implant is only partially covered by the muscle. Your muscle comes across your chest like this, diagonally. This is what we call origins, all along the breastbone, the sternum, and a little bit along the ribs here. And it comes up diagonally and inserts into the humerus, which is the bone that moves your arm. When we cut that muscle partially, it comes up a little bit. And you only get partial coverage of the implant anywhere from half to a third or even a quarter. Because that muscle is coming diagonally across your chest, a lot of the breast is down here, and the implant is covered partially by muscle and partially by breast tissue. And you may have heard of something called dual plane. And that's essentially what that means. There's a part that it's under the muscle and there's a part that it's not under the muscle, it's just underneath the breast because there's no muscle there. Surgeons can modify how much of the implant is covered by muscle, more or less, by cutting that edge of muscle to release it. In certain patients, you might want more muscle coverage. In certain patients, you might want less muscle coverage for the implant to sort of drift down and fill out a lower breast or a more droopy breast. And these are technical things that we do to improve our results to give patients the very best results possible. So in this case, Kylie's surgeon has decided to place the implant half under the muscle, half underneath the breast, which is what we call dual plane. which is a very common thing to do, very standard thing in breast augmentation. But there's a new thing for patients to be exposed to, and I welcome this because it educates patients about how we do the surgery and how we could do the surgery better. So I hope this video can educate people to understand how Kylie got her breast augmentation and how you might want to get yours so that you can get a similar result. So I hope you like this video. Please give us a comment about what you think about Kylie's breast augmentation. If you like this content, please like it, subscribe to our channel, and we'll see you next time.